Liver function test, LFT, theory and practical parameters, normal range, purpose, diagnosis, symptoms, history, and conclusion. Theory and practical parameters. Liver function tests, LFTs, are a group of blood tests that assess the overall health and function of the liver. They provide valuable insights into the liver's ability to metabolize and excrete substances, as well as its role in protein synthesis. Common LFT parameters include alanine aminotransferase, ALT, aspartate aminotransferase, AST, alkaline phosphatase, ALP, total bilirubin, direct bilirubin, albumin, total protein, gamma glutamyltransferase, GGT. Certainly. Let's explain each parameter of liver function tests, LFTs, in detail. 1. Alanine aminotransferase, ALT. ALT is an enzyme found mainly in liver cells. When liver cells are damaged or injured, ALT is released into the bloodstream, leading to elevated levels in the blood. Elevated ALT levels are indicative of liver cell damage and are commonly associated with conditions such as viral hepatitis, fatty liver disease, alcohol-related liver disease, and drug-induced liver injury. 2. Aspartate aminotransferase, AST. Like ALT, AST is an enzyme present in liver cells. However, AST is also found in other organs, such as the heart, muscles, and kidneys, making it less specific for liver damage. AST levels can be elevated in liver diseases, but they can also rise in heart attacks, muscle injuries, and other non-liver-related conditions. 3. Alkaline phosphatase, ALP. ALP is an enzyme found in various tissues, including the liver, bones, kidneys, and intestines. In the context of LFTs, elevated ALP levels typically indicate liver or bone disorders. Liver-related causes of increased ALP include bile duct obstruction, as in gallstones or tumors, liver tumors, and certain liver infections. 4. Total bilirubin. Bilirubin is a waste product formed during the breakdown of hemoglobin in red blood cells. It is processed by the liver and excreted in bile. Elevated total bilirubin levels can occur due to liver dysfunction, obstructed bile flow, as in gallstones, or increased breakdown of red blood cells. 5. Direct bilirubin. Direct bilirubin, also known as conjugated bilirubin, refers to the bilirubin that has been processed by the liver and is excreted into the bile. Elevated direct bilirubin levels suggest impaired bile flow, such as in conditions like cholestasis or bile duct obstruction. 6. Albumin. Albumin is a protein synthesized by the liver. It plays a crucial role in maintaining oncotic pressure and transporting various substances in the blood. Low albumin levels can indicate liver damage or chronic liver disease, as the liver may struggle to produce enough albumin. 7. Total protein. Total protein measures the overall protein content in the blood, including albumin and other proteins. Abnormal total protein levels can be an indicator of liver disease, kidney disease, malnutrition, or other systemic conditions. 8. Gamma glutamyltransferase, GGT. GGT is an enzyme found in liver cells, bile ducts, and other organs. Elevated GGT levels are sensitive to liver and biliary tract diseases. It is often used in combination with other liver tests to help diagnose alcohol-related liver disease and cholestasis. In conclusion, liver function tests, LFTs, measure various enzymes, bilirubin levels, albumin, and total protein in the blood to assess liver health and diagnose liver-related disorders. Abnormalities in LFT parameters can indicate liver damage, inflammation, or impaired liver function, which may prompt further evaluation and management by healthcare professionals. Interpreting LFT results in conjunction with clinical symptoms and medical history is essential for accurate diagnosis and appropriate treatment planning. Normal range. The normal range for each LFT parameter may vary slightly between laboratories. Typically, the reference ranges are as follows: ALT 7 to 55 UL, AST 8 to 48 UL, ALP 45 to 115 UL, total bilirubin 0.3 to 1.0 mg/dl, direct bilirubin 0 to 0.3 mg/dl, albumin 3.4 to 5.4 g/dl, total protein 6.0 to 8.3 g/dl, GGT 8 to 61 UL. 3. Purpose and diagnosis. LFTs are performed to evaluate liver health and diagnose liver disorders. They help detect liver inflammation, damage, and impaired function. Common liver conditions diagnosed using LFTs include hepatitis, viral or alcoholic, cirrhosis, scarring of the liver, liver tumors, gallbladder disease, liver infections. Symptoms and history. Doctors may order LFTs if a patient exhibits symptoms suggestive of liver dysfunction, such as jaundice, yellowing of the skin and eyes, fatigue and weakness, abdominal pain and swelling, unexplained weight loss, nausea and vomiting, changes in urine and stool color. A patient's medical history, alcohol consumption, and medication usage are crucial factors considered during LFT interpretation. Conclusion: liver function tests are vital tools for assessing liver health and diagnosing liver-related disorders. They measure various enzymes, bilirubin levels, and proteins that reflect liver function. The results, when interpreted in conjunction with symptoms and medical history, help doctors identify liver conditions and plan appropriate treatments. It is essential to note that LFT results can be influenced by other medical conditions, medications, and individual variations. Therefore, any abnormal LFT results should be discussed with a qualified healthcare professional to determine the underlying cause and appropriate management.